Dr. Rusty Oshita, owner of Urgent Care Now and leader of the vaccination clinic in South Sacramento, says after the nationwide pause on the J&J vaccine, safety has been the main concern for many of his patients.
And the questions are the vaccines safe? The Pfizer vaccine has been delivered to more than 300 million people worldwide. We have a very good safety profile with that. We're going to continue using the Pfizer vaccine and Moderna vaccines until we get more direction and narrative from the CDC.
A survey by the U.S. Department of Health and Human Services on COVID vaccine hesitancy shows 23% of Hispanics, 15% of Asians, and 9% of Blacks in Sacramento County are uncertain about the shot. Dr. Anthony Itens with the California Endowment, a nonprofit focused on accessible health care for underserved communities. He says the pause in the J&J shot should encourage, not deter people from getting vaccinated because it shows the transparency and care the CDC is taking to understand side effects even when they are rare.
The benefits outweigh the risks so dramatically, particularly for African American populations. And the good news is that, for those of you who you really would prefer not to get the Johnson & Johnson vaccine, the Moderna vaccine and the Pfizer vaccine are available.
Los Angeles County Supervisor Holly Mitchell says African Americans should compare the small percent of people who got sick to the number of Black people affected by the pandemic.
We have to put in context our lives, the fact that we are essential workers, and the increased likelihood that Black people have in testing positive versus having a side effect from one of these vaccines.